So we have lots of different options for stress incontinence, and that's going to be your typical coughing, sneezing, jumping, running kind of leaking.
So I'm of a certain age where I know there's women that, when you laugh or when you're jumping or running or just things like that, sneezing, sometimes we have some accidents, right? We have we know, if you know, you know. So Dr. Laura Foote is here and she's going to tell us about some things that can help you that you don't have to actually deal with that.
Yes, and I'm so glad you're here. So I hear every single day, I'm just old, I know this is what's going to happen. And that is exactly the wrong answer, right? Yes, it does get worse as we get older, but it doesn't mean we have to be okay with it. So we have lots of different options for stress incontinence, and that's going to be your typical coughing, sneezing, jumping, running kind of leaking. Of course, there's physical therapy. We all have been told to do Kegel exercises since the beginning of time, and it's helpful. And I love pelvic floor physical therapy because it puts the control back in your hands. And that can be really powerful when you feel like your bladder is controlling you. But when that's not enough, we do have other options, surgical options. One of my favorite is called BULKAMID, and BULKAMID is a minimally invasive option, which we do through just a little scope. It's basically lip filler for the urethra. So we just inject a little bit of a water-based substance into the urethra to bring the edges together, and that just improves the resistance and helps your leaking pretty substantially.
And how long does that last?
About 5 to 7 years.
Wow, so better than lip filler.
Yes, better than lip filler. I don't know the price difference, but definitely better than lip filler. It also doesn't close doors, right? So we can put it in, and if we're happy, fabulous. If we're not, we could always put a little bit more in, or you could always move forward with the surgical sling, which is kind of the gold standard operation where we implant a little piece of mesh tape that goes right underneath the urethra and forms scar tissue to recreate the backing of the urethra so that when you cough or sneeze, angles are maintained, and it gives you a 90% improvement and will last 20 years and counting. So it works really well. It's just a little bit longer recovery, right? And it's more restrictions and things like that. So you kind of have to figure out what's going to work best for your lifestyle right now. But the wrong answer is I'll just deal with it because there are so many things that we can explore.
Does insurance cover it?
Yes.
Awesome.
Yes, I have never had an insurance issue. As long as we document things properly and do it the right way, they cover everything. And so it's been a really good complement to our practice.
Love that.
Yeah, it's good.
So now you can sneeze
Yes.
and be not scared anymore.
Exactly, exactly. Eventually you'll sneeze without crossing your legs, but it takes a minute before you trust it.